A patient today came into the office stating that over the weekend, they actually went to the emergency room because they were concerned that they were having a heart attack. They stated that the workup in the ER was insignificant in terms of the providers there finding no evidence that that was actually what was happening. They stated that when this occurred, they had been at home and they were kind of going about their normal day, but things had been a little bit more stressful than usual. But really, all of a sudden, basically, they started to feel lightheaded. They had some tightness in their chest. They felt that their heart was beating faster than normal, and they felt that they could actually feel their heart beating up kind of into their neck. They were having difficulty kind of gasping for air, and they needed to sit down pretty quickly because they were worried that they were actually going to pass out. This feeling lasted about 5 or 10 minutes, and then it actually went away pretty quickly, but it was extremely scary for this person, and they thought that they needed to go to the ER right away. First of all, I want to say that if this ever happens to someone, you should go to the emergency room right away, because God forbid, if you're actually having a heart attack, you need immediate attention. But I also want to say that for a lot of individuals, this is actually what a panic attack looks like. And when this person was discharged from the emergency room, their directions were actually to seek out a mental health professional to discuss treatment of a panic disorder. So I was very glad to see them in the office. We talked about medication options and other options that could be very helpful, specifically medications that didn't have abuse potential for anxiety disorders. And we also talked about their stressors, talked about therapy, mindful meditation, diet, exercise, limiting caffeine, and some other items that could be pretty helpful for them in terms of preventing panic in the future. If you believe this video pertains to you in any way, please be sure to contact a medical and mental health professional to discuss setting up an initial visit. And again, if you ever have any symptoms like this, do go to the emergency room or see a provider immediately, because these could be the symptoms of a heart attack or something else more serious that is happening. But again, this is a common presentation for what you call a panic attack.